and welcome everyone to our monthly awareness. My name is Jeanette Rodriguez. I'm the program coordinator at the Riverside Medical Clinic Charitable Foundation. And first off, before we get started, I want to thank our wonderful sponsor, the Riverside Medical Clinic. We have such great information that we want to share with you today. And without giving too much away, I want to go ahead and introduce my guest speaker. I have two of them, but I'm going to introduce one for now. Her name is Teresa Dinh Watanabe, and she is a leader in fighting for the community. As the Senior Executive Director of the Arthritis Foundation, she helps conquer everyday battles with life-changing information and resources. Access to optimal care, advancements in science, and community connections are also part of what she does in her community. So under Teresa's leadership, the Arthritis Foundation in Orange County and Inland Empire has received 3 awards and is recognized for outstanding leadership in areas of fund development and mission and public policy. So I'm going to go ahead and give the floor to Teresa, and I'm going to go ahead and set up that PowerPoint for you.
Thank you, Jeanette, and we're so excited to be speaking to all the attendees today about one of my favorite topics. The reason why I continue to fight for the Arthritis Foundation is because of all of my juvenile arthritis friends. When I started here at the Arthritis Foundation 9 years ago, almost 10, I was recruited, and the first thing I thought about was Arthritis Foundation. Arthritis is an old person's disease. You know, I was helping kids who were abused and abandoned, but shifting my way to arthritis, I had no idea that 300,000 kids got arthritis and that there was a shortage of pediatric rheumatologists. I didn't know that kids got arthritis and it was attacking their immune system. It was affecting their eyes. It was affecting their, ability to get to school. They would be bullied about having arthritis. Some days they're going to school walking normal, and some days they're in a wheelchair and they're getting picked on. And so it really opened my eyes to learn about kids with arthritis. And I've met so many wonderful families, so many wonderful kids. And this deck that you're going to see shortly that I was put by Samantha really touches my heart, because it really shares the stories of some of the kids who are here local in your community, local to Riverside County, to Orange County. We know we have some juvenile arthritis moms on here right now supporting us. And so we wanted to welcome Samantha. Samantha has been with the foundation for several years. Her daughter is Melody. Her daughter was a former juvenile arthritis honoree. Samantha is the PTA president at her school, and she also is a Connect facilitator for the Arthritis Foundation. And if you need some cool swag, she also sells LuLaRoe. She didn't even tell me to put that plug in there, but she's an all-around wonderful mom, and she is going to be taking over the presentation, in which we will be doing questions and answers at the very end. So Samantha, take it away.
Thank you, Teresa. And thank you, Jeanette, and the Riverside Medical Clinic Charitable Foundation for having us today. So this talk is about juvenile arthritis and a little bit about my child. So I am not a doctor. I'm not a specialist of any kind. I am just a mom who has a child with this diagnosis, and we've been dealing with this for about 5 years. So I feel like I'm pretty knowledgeable and learning a lot from the Arthritis Foundation in all of this. So that is why I am sharing this with you today. So let's go ahead in the next slide, Jeanette. So my name is Samantha Tauzon. My daughter's name is Melody. And this picture right here is one of her favorite things in the whole world. She loves animals. This is our cat, Daniel Tiger. And she has JIA, which is short for Juvenile Idiopathic Arthritis. Next slide. So I'm probably knowing what you're thinking about. Kids get arthritis? Like, I never knew that prior to 5 years ago. And, you kind of only think of older people having arthritis. And it's an eye-opening thing to learn that children of any age could be diagnosed with kind of an old person's disease, let's call it that. So I'm happy to share more about juvenile arthritis today. Next slide. So there are many types of arthritis that kids can get. We kind of talk about how it's an umbrella of arthritis is a big umbrella of all kinds of diagnoses underneath it. So I put in here some of the diagnoses that children can be affected with, and that's systemic. And I'll just kind of pinpoint a few little things about each little one. Systemic actually involves your organs inside your body that can cause a lot of pain and inflammation pretty much anywhere in your body and also in the organs. Oligoarticular, that is fewer than 5 joints affected. Polyarticular is 5 or more joints affected. Psoriatic, which my daughter is actually diagnosed with, that's her official diagnosis, and that can cause, you've probably heard of psoriasis. It could cause some of the skin issues along with swelling and joint inflammation as well. And then spondylopathy, that's a hard word to say, can also affect your spine in some children, and lupus as well can affect your tissues and organs. And there's many, many other arthritis diseases out there underneath this umbrella. I was pinpointing a few that you might hear in some of the slides coming up. So like Teresa said, there are around 300,000 babies, children, and teens who have juvenile arthritis in the US right now. Kind of crazy to think about, especially when you might not have heard that kids can get arthritis, and that's a pretty large amount. So next slide. So it pretty much goes like this. Your child starts complaining of pain at any age, any kind of pain. When our daughter was complaining about her knee hurting, we just like, oh, it's just growing pains. No big deal. You know what I mean? Oh, suck it up. You're good. Come on, shake it off. And then just one day you'll see your child with a swollen knee or a swollen knuckle, or you see the effects of the swelling. You see the effects of the pain that your child has been going through. So at first, as a parent, you're like, oh, did you injure yourself? What happened? So then you go to the doctors and they do all the blood tests, and your child is diagnosed with a chronic disease, which cannot be cured. There is definitely medications that can cause, help the effects of pain and inflammation, but there is no cure as of right now. So next slide. So I would like to share about some of we call them our JA family. And I specifically put these children on these slides because they are local to Southern California, and they're very dear to my family's hearts. So this is Sophia. I believe her mom is on. What's up, Annie? Hi. She is 11 years old. So let's hear about Sophia. Sophia was diagnosed right after she turned 2 years old with polyarticular JRA in her right ankle, left knee, and now it is also in her jaw. So you've heard me talk about JIA. Her diagnosis is JRA, which is juvenile rheumatoid arthritis. And that just means that in her blood work, her diagnosis she has rheumatoid arthritis. There's a blood test called the rheumatoid factor. It can either come back positive or negative, and hers came back positive. And it's a little bit more of a serious diagnosis than considered to JIA. So Sophia is 11 years old and receives weekly methotrexate injections as well as Remicade infusions every 4 weeks. So you might hear the word methotrexate come up. My daughter's also on it. Methotrexate is a form of chemotherapy. It's a low-dose chemotherapy drug that can lower the child's immune system to calm all the inflammation in her body. That's what it's pretty much doing. So despite the obstacles JRA has thrown at little Miss Sophia, she hasn't let that stop her from doing the things she loves, like playing soccer, boogie boarding, dancing, photography, and enjoying time with her friends and family. So next slide. This is Jaylyn. Oh, I forgot to say, Sophie is near Orange County. She's real close, Fountain Valley. So not too far away from us. Jaylyn, she's 19 years old. Her family lives in Redlands, California, very close to Riverside, I believe. Jaylyn was diagnosed with polyarticular JIA in September of 2017. So she wasn't super young. She was a teenager, and you'll just hear any child, any age can be diagnosed with JIA. She is not letting her diagnosis stop her from achieving her dreams. She is currently attending college full-time and holds down a job at a craft store. She's a lover of all things Disney, K-pop, and her JA family. Next slide. Next, we have little Avery. She does live in Northern California. We met Avery when I think it was at a national JA conference a couple years ago, and she's the sweetest little girl. So I'm going to share a little bit about Avery. Avery was diagnosed with polyarticular JIA at 17 months of age. She went from just learning to walk back to crawling. Her knees were really large and swollen. At age 4, she achieved unmedicated remission for a brief 4 months before flaring really bad. She started taking her weekly methotrexate and Enbrel injections again and was able to manage her arthritis. Recently, she was able to wean off her methotrexate and switch to bi-monthly Humira injections. She loves to read, sing, dance, swim, kayak, and spend time with her friends and family. And this is my favorite thing. This is the sweetest thing. When she grows up, she wants to be an art teacher, lifeguard, and a mom. Next slide. Next, we have Aubrey. She's very special to our family. She's kind of taken my daughter under her wing, as you can say, as a just a great mentor. And they both have the same diagnosis, and it's just really great to have those connections around. So Aubrey was diagnosed with JIA at the age of 8. Aubrey refuses to let JA stop her in anything she does, whether it be going to college and studying to become a teacher, doing the things she loves, or just having a life of yes, living a life of yes, sorry. JA has fueled her passion of being a counselor and volunteer at the JA camp she grew up at, which she loves more than anything. She enjoys working with the horses at her school, spending time with friends, and attending and helping with Arthritis Foundation events. And she is also, I believe she lives in Irvine or somewhere around Orange County, and attends Cal Poly Pomona. I love the sentence that she said, you know, she loves her JA camp. So she started as a camper, and now that she's of age, she is now a counselor and is just a wonderful young lady. Next slide. Next is little Mckenzie. She is 7 years old and just so adorable. The first 11 months of Mackenzie's life were like most other children. But as she was on the cusp of learning to walk, her parents noticed that she used her baby walker with a bit of a limp. After being misdiagnosed with a toddler fracture, they were referred to a pediatric rheumatologist at CHOC, or Children's Hospital of Orange County. That quickly gave them a definitive diagnosis of oligoarticular juvenile idiopathic arthritis, or JIA, under that umbrella. Since her diagnosis in 2014, Mckenzie has undergone MRIs, steroid injections, serial casting, and lots of physical therapy to regain strength in her right leg. After her most recent series of steroid injections in April for her right knee and ankle, she is currently in non-medicated remission. That is amazing. Next slide. Next we have Sage. Sorry, I need to move my little camera thing so I can read it. Sage is 18 years old. She is a huge inspiration in our little Arthritis Foundation world. Sage was diagnosed with SJIA when she was 8 years old. So SJIA is systemic juvenile idiopathic arthritis. Similar to many children who have arthritis, she had to find new ways to live her life to the fullest. But 10 years later, a jaw surgery, and lots of hope later, Sage is an extremely happy individual who can and will do anything she sets her mind to. She owns her horse and has been successfully showing him an AQHA. And I apologize, I have no idea what that is, but I'm sure it's very important. She owns her, she recently graduated high school 6 months early and as class president. She continues to carry happiness and hope into the future as she continues showing horses and begins working toward her bachelor's in biology with the plan to attend optometry school. So next slide. So this next slide, this is my little Melody. This is a picture of her when she was 3 years old, when we took her to get blood work, right when all this has been happening. You can kind of tell her left knee is a little swollen. In the left picture on the right side, you definitely can see her left knee. There, you can't really see a kneecap. It was that swollen. And then her hands, a couple of her knuckles are pretty fat and swollen there. So, like I said earlier, there was a couple weeks and we really thought it was just growing pains. She complained about her knee, and she kind of wanted to stay in her stroller, but we didn't really think anything of it until one morning. She was yelling from her room in the morning, "Mommy, Daddy," you know, and we're like, that's weird. You know, as a 3-year-old, she would just get out of her bed, come wake us up in our bed, but she was just yelling for us. And we go into her room and she goes, "Mommy, I can't get out of bed." And we're like, what? That's so weird. You know, did something happen? And we're trying, you know, we're looking at it and we see that her knee is very swollen. And then we found out her knuckles. So we were like, this is weird. We need to go to urgent care. And that's when all the doctor's appointments and blood work and x-rays and all the things happened. And at first we were a little in denial. It was kind of like, we've never heard that kids can get arthritis. So this is some kind of infection. It'll go away with medication. And just that denial. We didn't think that our daughter had arthritis, even though the doctor told us that this would look like juvenile arthritis. We were just like, oh no, it's nothing. So when a child is diagnosed with juvenile arthritis, they automatically send them to go see an ophthalmologist to check their eyes, which I had no idea. And I'm going into this appointment thinking she's got no problems with her eyes. She's fine. She can see fine and everything. But little did we know, when we were at the appointment, they use this special machine to really see through your eyes. It's pretty crazy. And she looks at us and the doctor said she has a lot of inflammation in the back of her eyes. They call them cells. And she pretty much said if we don't start medication, she can lose her sight. So me and my husband kind of looked at each other and we're like, we need to do something now. This is real. Like, I don't know what it was. It was the eye situation. I think just not knowing something, not being aware of a diagnosis of juvenile arthritis. You know, you don't want your child to have a diagnosis of any kind, but the eyes really scared us. And so at that time we started medication. Next slide, please. So it took about a month and a half to find what medications would be good for Melody. And we found out that Humira injections and methotrexate injections is a great medication dose for Melody, and she does pretty well on it. She does blood work and sees her pediatric rheumatologist every 3 months. She enjoys playing with her friends, basketball, and video games. Next slide. So let's kind of backtrack here. I know I've shared a lot with you about our friends and these little cute and young ladies who have this disease. So what is arthritis? And again, I'm not a doctor, so don't judge me. Arthritis is a disease of the joints. It's pretty much inflammation of the joints. So anything that can move, your elbow, your shoulder, your jaw, your knee, your fingers, your knuckles, you can get arthritis or inflammation in those joints. Next slide. So it's not just the pain and the inflammation that a JA child goes through. There's also some other symptoms. They can get high fever, skin rash. They can be super tired or fatigued, loss of vision due to uveitis, like I mentioned earlier, and actual harm to the heart, lungs, and other organs. Next slide. So it is kind of frustrating. We don't have all the answers. We don't know why kids get juvenile arthritis. As you know, we do have some clues, or not we, but researchers, doctors, scientists. They do know that it's not contagious and that it's sounding more like it is the child has an overly active immune system. So it's going around, it's looking for places to cause damage pretty much. And it then causes that inflammation in that joint. So like it says, there are definite clues. It may be the genes you are born with, which we actually do have some family members with some rheumatic diseases, and but I'm not going to blame them. Like, that's why my child has this, because of you. It's just, it is what it is. And I believe it makes the children stronger with this diagnosis. And so let's continue. So let's see. When a child goes through a flare, they have a joint affected. There's swelling, there's pain, and it's mostly invisible. You can't really tell. There are times that children can be in pain and there's no swelling, because possibly during a flare, there could have been possible joint damage to it. So it is kind of an invisible disease. You never know when the child is hurting. And I believe the next slide can share some more information as well. So you never know when these children are going to be in pain. It could be because they had too much activity, or it could be that they didn't do enough activity. Because if they don't do enough activity, they can become stiff. You know how you feel sometimes when you're staying in one place for a while, you can feel stiff. And these children, this is actually a picture of Melody. We were up in Big Bear for a family weekend a while back, and she just couldn't continue. So we just had to hang out at home, and that was totally fine. I believe having a child with juvenile arthritis, you kind of have to roll with the punches and kind of make sure your child is okay. And we've learned to adapt to all of that. But that is kind of a bummer. You never know what kind of day they're going to have. Next slide. So school, I'm talking about school pre-COVID era, okay? So pretend all the kids are at school so we can chat about this. It can definitely be hard for a child with juvenile arthritis or teenager. You can imagine middle school or high school. It's a lot of walking around to different class periods and carrying the books in the backpack, holding a pencil and writing for a long time. Their hands can get sore. And then also exercising in PE or playing at recess. Again, it could be too much activity, and it could affect their joints that they have issues with. Luckily, in public schools, they offer a 504 plan. Most schools offer a 504 plan, and that's what we've done with Melody for the last 5 years. It's kind of like a contract with the school and the teachers and the staff and the child and the child's family. It's pretty much a contract saying, my daughter can only do this for a certain amount of time. Like an example, when Melody was in kindergarten, one of the things on her 504 plan was she can't sit crisscross applesauce. You know how like little kids sit on the floor and they cross their legs. It was hard for her to do that and sit there for a long time and then be okay when she stood up. Like she was in pain if she sat on the floor for too long. So they would adapt and they would give her a chair and offer a chair. And as Melody got older, she was able to speak up a little bit more, like, hey, I can't sit down, so I'm gonna sit in this chair. So I think that's a great thing. If you have any kind of medical diagnosis, please ask your public school, if you do attend a public school, about a 504 plan. Next slide. So kids who have JA may have painful joints, go on lots of doctor visits, and get tired easily, but, next slide, we are definitely hopeful for a cure. Right when Melody was diagnosed in 2015, the first thing I did, I searched Juvenile Arthritis Support Group. And the Arthritis Foundation was the first website that I found, and I contacted them right away because we just felt so scared and alone. And again, because we didn't know that kids could get arthritis. The Arthritis Foundation, they offer many things for our children and other arthritis warriors, any of age. They offer JA days. We used to get together pre-COVID. And the kids got to get together, and the parents got to meet each other, and it was all local groups. It was through our Orange County Inland Empire branch of the Arthritis Foundation, and it was just great to meet other families. There's also a JA camp that the foundation sends these children to, which is away from their parents, and they know that they're going to be with other kids just like them, dealing with the same kind of thing. So they offer the National JA Conference, which we just had last weekend. We did have to go virtually, which is totally fine. But this picture right here, I believe Melody's there, and Mckenzie and Sage and Sophie, some of the warriors that I had talked about before, are in that picture, and that is at a JA conference. They also offer JA Parent Connect groups, which I think it's been about a year now. I'm a facilitator for a local group. We used to meet in Rancho Cucamonga, and now we are offering via Zoom meetings. They also offer adult arthritis connect groups. If you guys have any questions about that at the end as well. And they offer these really fun walks and runs for people of any age with arthritis. In May, they normally do the Walk to Cure Arthritis, and then the Jingle Bell Run is in December. So just so many awesome events that we've been able to be a part of because of the Arthritis Foundation, and to feel like Melody is not alone. I think that was our priority. We want to just encourage her that she can do this. She can do whatever she wants. You know, she might have her little struggles here and there, but she is a force to be reckoned with. Next slide. So I believe the next slide, we just have some pictures. Top left is a picture of me and my husband and Melody at the Jingle Bell Run. They had a really fun photo booth. The one on the top right is our walk team. We've got quite a big group that gets together every May. I think it's been 4 or 5 years 4 years that we've done the walk. And little Melody in there, she loves this walk so much, and it makes her feel so encouraged and almost like ready to take on the next year until the next walk. She knows that these people are coming out for her and for other people who are dealing with arthritis or any kind of rheumatoid disease. It's just a really great day where everyone can get together and celebrate these warriors. Bottom left picture is of Melody and little Mckenzie at the JA conference, and then bottom right, another picture from the Jingle Bell Run, and that has Sophie and her little sister Haley and Sage with the very famous Santa Claus. So that's pretty much it. I just wanted to thank you for letting me share a little bit about my experience and what I know about juvenile arthritis. And yeah, thank you so much. Thank you, Teresa and Jeanette and the foundation.
Okay, and then I have one slide to share because the Arthritis Foundation doesn't just take care of kids with arthritis. Although that is my passion, that's where my heart is, you know, seeing all the kids that have arthritis and seeing that they come to the foundation feeling, you know, hopeless, feeling alone, and getting these connections. And so, you know, as you can see, a lot of the juvenile arthritis moms and the kids, they all get to know each other. They become one big happy family. And so that's what warms my heart. That's the goal of the Arthritis Foundation, is to facilitate these connections so that there is a support group outside of your own home, outside of your doctor. So think of us as the resource from that time you see your doctor and that time you're at home. We can do everything in between to help you manage your arthritis. And so arthritis for kids, it affects more kids: cystic fibrosis, juvenile diabetes, and muscular dystrophies. If you take 3 of those diseases combined, more kids have arthritis in those 3 diseases. But it's not one of those diseases where, you know, it's well known. So thank you to your foundation here for allowing us to present on it. At the foundation, we do help people from kids to teens to adults to seniors. We offer help and support. So on our website, which is arthritis.org, we have, you know, a plethora of information. We give you connections into the community. We give you tips on your arthritis, how to deal with it, how to manage it, how to cope with it. We also offer a lot of funds to scientific discovery. So a lot of the advancements in medications that patients are receiving is because of the funds that the Arthritis Foundation has supported and funded. Many of the doctors that I work with, they love the fact that we fund research because they've seen advancements in medication where they're not just giving gold shots anymore. There's less crippling of the hands, less crippling of the toes because there is infusions, there's injections that are really making a difference. And so the foundation really is making that a priority to fund additional research. And then we also do advocacy and access to care. And so advocacy is really important because we not only advocate for children, but we advocate for all autoimmune diseases. So one of the biggest things that we did at the Arthritis Foundation is the step therapy bill. So let's say, for example, if you are a young adult or a child who has arthritis, your insurance would want to give you the cheapest insurance, a pill form. But if your doctor has seen a person like yourself who has rheumatoid arthritis that may need an injection or an infusion, your insurance is going to have you take the cheapest medication. And the first step in order for you to fail, even your doctor is going to know you failed it. And so the foundation has lobbied, which is called the step therapy bill, that allows the doctor to do their job, right? Give you the right medication at the right time so it's not irreversible damage. And so that is a huge win for us at the foundation. The advocacy side of it is a lot of volunteers and doctors who are going to your local Congress people or going to, DC to lobby for these things to pass. We also have our new website, which is arthritis.org cares. And so if you want to learn the latest on coronavirus news, questions, and answers as it pertains to arthritis, I know there's a lot of news that talks about medications that people who have arthritis and people who have COVID-19, they're using the medications for people with arthritis, which is creating a lot of questions and concerns. So if you go to that website, you can learn information on coronavirus news and access to medication. We also have tips on staying healthy, how to manage your pain, how to manage telehealth, and what you should be expecting, and how to navigate the new norm. And so, pay attention to the Arthritis Foundation's website. Really just navigate around it. There's just lots of information. JA, again, touches both of our hearts, but we do, help all sorts of people from, young to old. And with that, I am going to open it up and turn it back to you, Jeanette, to see if we have any questions that we can answer.
Yeah, I have a couple, but I think you guys were actually very thorough, and I think you answered some of them. But I'm still going to go ahead and let you answer them. I think the number one question is, as a parent, I know you had said denial is that first reaction to becoming, understanding of JA. What is your best advice to a parent that might just have gotten their child diagnosed with some type of JA?
I think what brought me relief was when I did contact the Arthritis Foundation. They had someone call me, and I asked all those scary questions. Like, this doctor wants to put her on these medications that I'm terrified of, and the lady that I was speaking to was an adult who actually grew up with juvenile arthritis. So she's like, I was on that medication when I was younger, I'm doing fine. So it kind of, I definitely think support, talking to somebody, finding somebody who's going through what they've gone through. And ever since we've been, since we've gotten this diagnosis for my daughter, we do a lot with the Arthritis Foundation, and I post a lot on social media, and any of my friends, if they hear that one of their friends are dealing with their child having juvenile arthritis, they connect us right away. So I think also advocating and getting the word out there that kids do get juvenile arthritis, I just think support is huge, to kind of like let the person know you are not alone. We've got this. We've got a huge JA family behind you, and we're just here for you. I think that's the biggest thing, is support.
And I'll add to it, if you're newly diagnosed, you can reach out to your pediatric rheumatologist, or you can even just go directly to the Arthritis Foundation website. We have power packs. It's a fancy name for a backpack that has information on, you know, student and arthritis. You can give that brochure to the teacher. It has a thermal bear. It has a diary guide in there. It has some information on camps and our conference. And so that you're not feeling alone, we provide these backpacks, basically all the services at the Arthritis Foundation for free as a value-added service. When I spoke to the pediatric rheumatologist at Chalk Hospital, you know, they gave 300 something backpacks away one year. And I told him, I was like, this is fantastic. And he said, you know, the families who are initially diagnosed, they don't want the backpack because they think this is going to go away. They think this diagnosis is going to go away until they come back again and realize, okay, then I need to really do something. And that's when they actually get the postcard, they fill it out, and they get that power pack. So I think just, you know, as a newly diagnosed family, and accepting it is going to be hard, but once you do accept it, the foundation's here to help you with whatever you may need. And so just remembering that, you know, when you come to terms with it, we're here to support you, and we can connect you to other moms, other dads. All the dads, you know, they learn that they have to not, you know, be in the back seat. They have to be really there for their kids. And so there is a group of the JA dads. They call them the tribe. They have a fancy name for the JA dads. And so, you know, we're here to support you when you're ready.
And Melody still uses that bear from that power pack as a heat. It's mainly a heat pack that you can put in the microwave. So when she's in pain, she gets that bear out. You know, we've been using it for the last 5 years. It means a lot to her.
Wonderful.
Oh, that's awesome. I'm so happy to hear that. With that being said, how do you explain to a child what JA is? Especially when they're very young, right? I know you said Melody had it at 3, was diagnosed at 3. So how do you explain that to a young child?
That was very difficult. I mean, she was 3. She didn't really understand why she was hurting or why it hurt to walk. But I think, I mean, Teresa mentioned the step therapy. While we were waiting for, you know, the cheapest medication to go through, I mean, every joint was being affected. I mean, I feel like every day a new joint would be affected. And this little 3-year-old was hurting more and more and more. And we couldn't do anything. And then finally, the doctor said you had 6 weeks to try this medication. It's the cheapest medication. And at that 6 weeks, I was on the phone, like, okay, this isn't working. We need something, because it's so hard seeing your daughter in so much pain. And we were doing hot baths in the morning to relieve the pain, just anything that we could do. And it wasn't, I mean, the only thing that I can think about when we would give her medication, and then once we found out that the Humira, I mean, that was pretty much our miracle drug. It helped with the effects of the pain and the swelling. It brought it right down. We called it her superhero juice. I mean, as a 3-year-old, you kind of have to explain it a little bit like that. You know, even though it's a shot, like we've got to, this can make you like a superhero. It can make you, I mean, let's be real, like a normal child, not in pain. So that's what we kind of had to encourage her to keep going and entice her with superhero juice, if that makes any sense.
Yeah, I like that there's advocacy on medication. Before that form of having to actually use the cheaper drug, did you know anything about any of the other medication that was out there for her?
I didn't really know too much. I mean, we've been involved so much, and we've met other families like, hey, what medication are you on? You know, it's kind of a weird conversation to have. But I don't know. I'm not quite. What was the question again? Sorry.
Did you know about different medications? The foundation also has a drug guide too. So we publish a drug guide that is free. I know many of the doctors, they ask for that drug guide, but it basically is a magazine. So you can look at the different options and what medications are given, and, you know, see what your options are. But we also have a hotline. So let's say if you are prescribed something and you're not sure about it, you can call our hotline, or you can call your doctor first. I would talk to your doctor about it, but we do have a hotline to help answer some of those questions as well.
And it's also due to what kind of diagnosis too. I think my daughter was put on Humira because they've seen higher rate of getting that inflammation to go away as compared to Humira and Enbrel. So it definitely is a good question for your doctor to find out what other medications are out there for your child as well.
Yeah.
Perfect. I think you've answered the other one. So the other questions were, how can a parent connect to a support group? And I think you gave us a great resource. If anyone's on here and wants that resource, I'm going to go ahead and enter my email at the end of the presentation so that you can go ahead and email me and I can connect that resource with either Teresa or Samantha so you guys can guide them a little bit better, or if you can go ahead and forward that to me. Oh, perfect. You've added that on there. And then going back to support groups, how well do children do when they connect with other kids that are going through the same thing?
I mean, I would like to hope that it has an effect on her, that we've gotten to be with so many other families. But, you know, they're at different ages, they go through different things. You know, if a teenager, they might not want to, you know, talk to other kids. It might not be the coolest thing, you know, where maybe a 6 or 7 year old, you know, oh, there's somebody else that's like me, you know. I think it's just really important to get them together.
I'll give you the perspective from the foundation side of it, 2 examples. So I had one of the girls who went to JA camp, and, you know, for her very first time, when she came back, I asked her, what did you like? She's like, okay, I love the food. And then the second thing I asked her, what did she like? She said, I learned to meet other kids like myself, where, you know, she was a teen and her mom would give her injections. They would have a routine. They would do all that stuff. But other teens were giving themselves their own injection, because when you go to college, mom is not going to be there. So they learn how to be more independent. They learn that there are other kids like themselves, that they're not being isolated. They're not being treated different. So these, you know, camps, these conferences, these support groups are really nice for you to feel that you're not alone in this disease. You know, it's 1 in 250 kids that have arthritis. And so, you know, for you, sometimes, you know, people can't understand why you have arthritis, or, you know, it's an invisible disease. So they say, well, how do you have arthritis when it's your grandmother's disease? And so just bringing kids together is really important so that they can understand it. And then my other example is a young adult. You know, he went to camp, and he went to camp initially not really wanting to go, and his parents encouraged him to do it. And when he got off the bus, he just, you know, his head was really down. He didn't really care for it. But at the very end of camp, you know, teen camp, when he met other kids like himself and they spoke through all their challenges, they were dancing one evening, and he was the best dancer in the middle of the crowd. Just, he left like a new kid. And so these connections are really important. And we found at the foundation, is we've done a lot of surveys, is when we bring somebody to the foundation, we give them the connections, we give them the services, their quality of life goes up, because one, you don't feel alone. And, you know, their depression level goes down, because, you know, you're not feeling in this, you know, moment alone. And so that's what our job is at the end of the day, is just to really connect people to our services, and just to really help additional people in the community, and connect, you know, families to Samantha, to other kids like Melody.
So funny, I'm reminded when Melody was in probably 1st grade. She's very vocal. I mean, we were always involved. There was always events, arthritis things. We would get together with our JA families, and we would talk about it so much that on the playground of like a park, she, to any kid, she'd be like, you know what arthritis is? You know, I got, like, she was like sharing about it herself. So I think making it the norm, making it, you know, having them talk about it, having them meet other kids. I just thought that was kind of funny. She used to want to tell everybody, I've got arthritis.
Arthritis makes the most resilient kids. You know, being that I've been nearly 10 years, I've seen kids truly become superheroes, right? You know, they're given, you know, arthritis, the silver lining behind all of that is that they become some of the strongest kids, able to speak in front of crowds, able to present in front of people, in which your average child doesn't get those opportunities to do that, and to be so resilient and be so brave.
And then the final question that I have here, and if anyone else does have a question out there, feel free to put that in the chat box. are there any types of sports that are limited to a child diagnosed with JA?
Teresa, do you want to?
Is there any type of support that is limited to children?
Are there any sports that are limited?
Sports. Oh gosh, I think it all depends on the child, right? You know, when we're offering different juvenile arthritis days, we try to host them at different locations that are fun for families. One was an aerial fitness place, and we were worried, you know, would parents think it's bad that their, you know, their kids are flying in the air and doing different things? I think it all depends on how your child's feeling, what joints are affected, you know, their ability to do stuff. You know, one day they may be feeling good, one day they're not, but I've seen lots of kids partake in different sports and then, you know, they tap out the days that they don't feel well. And so I think it's really up to the parent, the doctor, and the child to figure out what works for them. And if they're responding to the medication, they can do certain sports, but if they're not, they might have to sit out. So Samantha, take it from a mom's side.
Well, we just went through this. Melody had never done any sports before because she didn't want to. She was hurting, and she, you know, but as you get older, as the child gets older, she wanted to get involved with stuff, and she just was in a basketball league in January, and right before everything happened. And like you said, Teresa, they're very resilient. She pushed herself so hard during practice and the games. Even though she was the smallest on the team and probably the slowest, and she pushed herself. And afterwards, you know, she'd ask for the pain meds, and she'd ask for the heat pack. But, you know, I think it's also what they put their mind to. And as they get older, they tend to learn by themselves how much they can and can't do. So if it's something that you really want to do, you're going to push yourself. And that's what we saw. I mean, the first game, I was like in tears because, I don't know, this whole journey of her hurting and in pain, and now she's like on a basketball court. I was very emotional that day. It was probably very embarrassing. But it was just really cool to see her, you know, put her mind to something and learn from that. That was very cool.
Yeah, that's great. I know that when you say arthritis, going back to the presentation on how people are quick to assume that this is just something that older people get, more mature people get, people automatically will think, okay, if a child has it, maybe they're limited to what they can really do. But I think maybe the limitation comes from just not being aware of what they can actually achieve if they really want to put their mind to it. So that's awesome. Yeah. I'm so happy for your daughter.
Yeah, thank you.
Yeah. I don't see any more questions on here. I will be adding my email for anyone that wants extra maybe assistance. I would be more than happy to help you out and guide you in the right direction. Let me type that in real quick. Okay, there you are. I want to thank Teresa and Samantha for joining me today and bringing much needed awareness to this JA for, you know, in children and to this community that I think is very deserving of that. Okay, sorry, I thought I saw something pop up. But again, just thank you for taking the time and sharing something with us. If there anything else that you might want to add, go ahead and do so before we go ahead and close out. Is there anything you want to touch base on before we leave?
We just thank you, and we appreciate the awareness for kids who have arthritis. And, you know, all the kids that you saw through the slideshow there is, you know, a lot of people don't know that kids get arthritis. And so if you learn something from this website is, you know, reach out to the foundation for anything you may need and let people know that kids get arthritis too.
Mm-hmm. Yeah, thank you so much for providing the platform for us to share a little bit about juvenile arthritis.
Yeah, of course. I want to go ahead and thank everybody for joining us and learning with us. I think mainly learning with me. I really, really liked having you guys on. So I want to, you know, let everyone know that we have come to an end, and we will hopefully be doing more of these. So thank you for joining us. Again, Teresa and Samantha, thank you for helping me host this today. And I hope everyone has a great afternoon.
Thank you. Have a good day.
Thank you.
Bye, everyone.
Bye.